Hello, today we are going to be talking to you about strokes and aphasia. So, a stroke occurs when blood is unable to reach an area of the brain due to a block or ruptured artery. There are two types of strokes. One is ischemic, which is when blood vessels are blocked, and the other is hemorrhagic, which is when a blood vessel ruptures. Both types can be extremely dangerous and have lifelong effects. If you're interested in learning more about stroke prevention, you should reach out to your doctor or healthcare team. But a healthy diet, exercise, limited alcohol, and not smoking are all lifestyle choices that can help prevent strokes. Managing your medication, cholesterol, blood pressure, diabetes, and heart disease are important as well. So some signs and symptoms of strokes are numbness or weakness in the face, arm, or legs, especially if it's on one side of the body, confusion or trouble speaking or understanding speech, trouble seeing or trouble walking, dizziness or problems with balance, and severe headaches are also a symptom. If you think someone is having a stroke, always remember to act fast. F stands for face, so you can ask the person to smile and see if one side is drooping versus the other. A stands for arms, so ask the person to raise their arms and see if they're experiencing any weakness. S stands for speech, so you can ask a person to repeat a single phrase to see if they're having trouble talking. And T stands for time. So with a stroke, every second counts. So if you see any of these signs, dial 911 immediately. Some common disabilities that can occur following a stroke are paralysis or weakness on one side of the body, trouble swallowing, which is known as dysphagia, sensory issues such as loss or feeling on one side of the body, physical and mental fatigue, anxiety and depression, and aphasia, which we'll talk more about in just a minute.
So, what is aphasia? Aphasia is an acquired language disorder that is the result of brain damage from the stroke in the language dominant area of the brain. About 30 to 35% of stroke survivors have aphasia upon discharge from the hospital. 100,000 to 180,000 people acquire aphasia each year in the United States, and 2 to 4 million people in the US are currently living with aphasia. The signs of aphasia will vary depending on the area of the brain that was damaged by the stroke. Someone with aphasia may have multiple of these symptoms or just a few. These symptoms can include difficulty talking. They may have trouble thinking of words or they may use the wrong word. They may make up words and switch the sounds in words, and they also may have difficulty saying sentences. Additionally, the individual may have difficulty understanding. They may not understand what others say, especially in environments that are noisy or when someone is speaking very quickly. They may have difficulty reading or writing. Reading could include books, menus, or their television screen. They may have difficulty spelling and writing words to form sentences. They may also find it hard to text and use numbers. If you know someone or have a loved one who has aphasia, these are some tips from the American Speech Language Hearing Association of how to best communicate with that individual. First, you should always get their attention before you speak. You need to pay attention to their gestures and their body language as they try to communicate with you. Try to hold your conversations in a quiet setting. Use simple words, but don't talk down to them. Use shorter sentences and repeat the key words that you want to make sure they understand. Slow your speech down. Give them time to speak and don't speak for them. Try using drawings, gestures, facial expressions, and writing if they are having difficulty understanding you. The same way, if you are having trouble understanding them, you may ask them to draw, write, or point when they are struggling to talk. Asking yes or no questions when possible may be helpful so they don't have to answer in super long sentences. And finally, try to let them be as independent as possible, but provide them with help when they need it. The following are some additional helpful resources that you and your loved ones can reach out to and find more information and resources if you have aphasia. This includes the Aphasia Hope Foundation, the National Aphasia Association, the American Stroke Association, and finally, the American Speech, Language, and Hearing Association.